Here is our audience. There's Peyton, Brandon, and Steven. Okay, so our topic today is management of phobia and anxiety. So when you think of phobia, what comes to your mind? Any ideas, guys? Peyton?
When someone is afraid to go to the dentist.
Steven, any idea?
I have to agree. The first thing that comes to mind is a small child who doesn't want to go to the dentist because they're afraid of pain.
That's good. Okay, so it could be a patient covering his or her mouth during a procedure. It could be a patient staring wide at the ceiling. Or it could be a patient like a small child crying in your chair. So here are some facts about phobia and anxiety. Between 9% and 20% of Americans avoid going to a dentist due to anxiety or fear. This is a good proportion of the Americans. This is why it is important for us to address this problem because people with phobia have a higher risk of gum disease and early tooth loss. Avoiding the dentist may also have emotional costs as well. Discolor or damaged teeth can make people self-conscious and insecure. They may smile less or keep their mouth partly closed when they speak. Some people become so embarrassed about their teeth that their personal and professional lives begin to suffer also. There's often a serious loss of self-esteem. People with phobia may also suffer from poor health in general and even lower life expectancy. This is because poor oral health has been found to be related to some life-threatening conditions such as heart disease and lung infection. We're going to go forward. So what are some of the signs of stress and anxiety? There are many signs of stress and anxiety. Every patient is different, and so are the reaction to stress and anxiety. However, some of the most common signs include shakiness of hands, sweating, rapid heartbeat, feeling faint, lightheaded, jumpiness, moving of the legs, and gripping of the arm of the dental chair. So we're going to watch a little video here about a patient in the UK. And let me just play it for you. I can find my mouse. Where is it? Here it goes.
The tooth fairy has to work overtime in the UK, with bad teeth costing the NHS around £2.7 billion every year. Regular brushing and flossing will keep most oral problems in check. But unfortunately, it won't help our dental case Thomas.
But I wouldn't say my confidence was that bad, but I was always conscious of the fact of what my teeth are like. But when I smile, I always try to keep my mouth closed so it can't be seen.
Fortunately for Thomas, there's no mouthful of mouldy moulders that will deter our dentist, James Russell.
How long have you been missing these teeth? I don't know, but I think it's been so long. It's been going on for a while. Yeah. How old are you again at the moment? Yeah, 20. Okay, so you started losing your teeth at a pretty early age. Yeah. And when was your last dental appointment? It's been a couple of years, a few years. Let's do it. Back together.
Remember, you're staring at the teeth of a 20-year-old here.
You've got a little bit of infection going on with the gums. Do you smoke? Yes. How much do you smoke? 20 a day. 20 a day? Okay. How often do you brush your teeth? Mostly in the morning. Okay, so you don't brush your teeth at night at all? No. Okay, and what kind of things do you drink just before you go to sleep? Fizzy juice. Fizzy drinks? Yeah. If you're drinking fizzy drinks and then you're going to sleep, all the sugar and the acid is just lying on your teeth and it's just having the whole night just to start decaying them, which is what's going on. That's it, big cheesy bit.
This is what you get when you use fizzy drinks as mouthwash.
Super wide smile. Okay, Tom, so we've taken the x-rays, we've taken the photographs, and it's time for us to sort of be pretty honest about what's going on really. And for someone of your age, I'm pretty shocked about how things are looking. Some of these teeth very clearly can't be saved. But the great thing is, some of them can be, and then around the teeth that can be saved, we can build you a little denture, or maybe eventually do some implants. But for you, at the moment, a denture is the only option we've got because of your smoking. Implants have classically about a 99.8% success rate if they're placed in healthy people. Smoking reduces that way down to 50.
But another reason for Thomas's terrifying teeth is his severe case of dental phobia.
Thomas is one of the most phobic people I've ever treated, and he's worried about pain that's going to happen in the mouth before we even started the treatment.
Thomas is not alone in being afraid of the dentist's chair. A survey by the British Dental Association found that 25% of people have a fear of visiting the dentist. For some people, the mere sight or sound of anything dental is enough to send a shiver down the spine. A lot of dental anxiety stems from a simple one-off unpleasant childhood experience in the dentist's chair.
I started getting scared of dentures around 14. I think it was just probably one bad experience, and that was it.
But not tackling your dread of the dentist will ultimately cost your mouth dearly, and you could end up with a set of gnashers like Thomas's.
I think anyone who's phobic about going to the dentist really should just remember that nowadays dentistry is not a painful discipline. You can be completely numb if it needs anaesthetic. It's not going to hurt. So I would suggest see the dentist. It won't be as bad as you think.
Okay. So, we're gonna get this here. And then, okay. So did you guys notice the things he was doing in the chair because of his phobia? Did you see? What
He
did
was
you notice?
holding onto the arms.
Yeah, that's a very common example of some signs of phobia. And then he was also shaking his leg, moving his legs a lot. Okay, so we're gonna go on, and the next thing we're gonna do is clarify the difference between the term fear, anxiety, and phobia, because people often use them interchangeably. So fear is an emotional response to an immediate threat or danger. Reaction, which is perceived as danger, include unpleasant cognition that something terrible will happen. Physical changes such as increased heart rate, perspiration, nausea, and hyperventilation, and also overt behavior such as shaking, pacing, or rapid speech. This layer response is often referred to as fight or flight. Anxiety, however, is an emotional response to a threat or danger that is not immediately present or is unclear. Anxiety may lead to the same cognitive, physical, or behavioral response as fear. However, anxiety may occur hours or days before an actual dental appointment. Phobia is a persistent, irrational fear of a specific object or situation that results in a compelling desire to either avoid the situation or to endure it with dread. Phobia can interfere with people's ability to function. In dentistry, phobia are likely to interfere with the achievement of oral health, often resulting in pain and suffering when oral health is neglected. Some examples of dental phobia include trouble sleeping the night before the dental exam, feeling of nervousness that escalate while in the dental office waiting room, crying or feeling physically ill at the very thought of visiting the dentist, or intense uneasiness at the thought of or actually when objects are placed in the mouth during the dental treatment, or suddenly feeling like it is difficult to breathe. So what are some things that can cause phobia or anxiety? There's some examples in that video that I showed you. You guys remember that he was stating? No? Okay. So it could be a needle or anything sharp. It could be a scaler or the noise of the scaler. It could be the noise of the drill or anything loud. the needle or injection in general, which are ranked as the #1 most fearful element of dentistry. It has been found that nearly 1 in 20 individuals avoid dentistry due to fear of injection. The level of fear varies from person to person, and some people are afraid of dental injection in particular, while others are phobic about any sort of needle. So what are some common reasons for needle phobia? We'll start with fear of pain, which is a very common reason for avoiding the dentist. This fear usually stems from an earlier dental experience, such as that kid in that video that they were showing through that glass, that was unpleasant or painful, or from dental pain and horror stories told by others. And then, like that dentist says, thanks to the many advances in dentistry made over the years, most of today's dental procedures are considerably less painful or even pain-free. The next one is fear of injection, or fear that the injection won't work. Many people are terrified of the needles, especially when inserted in their mouth. Beyond this fear, others fear that the anesthesia hasn't yet taken effect or wasn't a large enough dose to eliminate any pain before the dental procedure begins. Fear of the anesthesia side effects. Some people fear that potential side effects of anesthesia, such as dizziness, feeling faint, or nausea. Others don't like the numbness or fat lip associated with local anesthesia. Has anyone ever got local done on them, local anesthesia?
Yep.
Yeah. The first time you got done, the fat lip feeling, did that scare you? Or did
No.
they tell you it's going to feel fat?
Didn't bother me.
Did it bother you? Okay. Alright, so fear of helplessness and loss of control. It is common for people to feel these emotions and considering the situation, sitting in the dental chair with your mouth wide open, unable to see what's going on. The next one is embarrassment and loss of personal space. Many people feel uncomfortable about the physical closeness of the dentist or hygienist to their face. Others may feel self-conscious about the appearance of their teeth or possibly mouth odor. Okay. Most needle phobic have at least one bad experience with injection. There are various reasons why a dental injection may be painful, and that's what we'll talk about next. And it include not using tropical anesthetic, using a dull needle, not making the tissue taut or when you stretch it out and make it tight, not injecting gently, administering too quickly, which also cause a burning sensation. So if you don't use a tropical anesthetic or numbing gel, they'll probably feel that pinch when it goes in. So numbing gel should always be used for injection, which could often be painful. It really works if it's left on for long enough, which is about normally 3 to 5 minutes before you start injecting. The soft tissue will be so numb that you can't feel the needle going in. Were you able to feel the needle when you got an injection?
Yep.
You did? Did they put the numbing gel on first?
Yep.
Okay. You must have not dried it out and left it on there. But did it bother you though?
No.
No? Okay. Okay, when you feel it, was it painful or was it, you just felt it? You know it was
I just
present.
felt it.
Okay, then it worked.
Okay.
It shouldn't have been painful. That was the main
Alright.
point. Okay, so the dull needle can arise through multiple injections. The needle should be changed after 3 or 4 times. In the same area of the mouth, the tissue needs to be stretched to make the injection comfortable. Applying pressure is particularly important in the area where giving local painlessly is more difficult, especially in the palate. Administering the anesthesia too quickly is perhaps the most common cause of injection pain. Rapid injection can tear the tissue, which results in immediate pain following by soreness. It is also difficult to say exactly how long a comfortable injection should take because it varies a lot between different injection sites and technique. Now for the burning sensation, a burning sensation while being given local can be a result of putting the local anesthetic too quickly. but it can also be due to the difference in pH value between the local anesthetic solution and the soft tissue in the mouth. Some type of anesthetic can be difficult to do without causing any discomfort. It is not possible to guarantee that every injection will be 100% painless, but discomfort can be minimalized by making sure topical anesthetic is left on for long enough to work properly, which they did for you because it wasn't painful, by injecting very slowly and by applying pressure for certain type of injections such as the palate. Avoid giving painful injection is key to the management of denyophobia, and as well as help preventing creating denyophobia and anxiety in your patients. It is important to recognize signs of denyophobia and anxiety at the beginning of your appointment, during assessment, before you start any treatment, in order to address the problem to avoid making matters worse. So in order to do this, you would need to figure out what the cause of the denyophobia or anxiety are. Did I do that right? Yeah. And there are many reasons why people have denyophobia and anxiety. So we're going to go into the development of the fear. So fear of dentistry is complex. The most common cause has been termed a direct negative experience, usually of pain or fright to a perceived threat of harm. This experience may originate in a negative personal interaction with the clinician or the hygienist or the dentist. The experience of pain alone does not necessarily lead to fear and avoidance of dentistry. The manner in which a clinician manages a patient's emotional reaction to pain or the anticipation of pain is more important determinant of whether or not dental fear develops. The International Association of the Study of Pain, which is the IASP, defines pain as the experience occurring with or without tissue damage. In the absence of injury, the cause of pain can be hidden from the clinician. In the absence of obvious injury, it is the patient alone who determines whether or not pain has been experienced. The self-determination can lead to emotional reaction arising from unpleasant experience perceived by the patient. The response of the clinician and their behavior in the face of these reactions can be critical. If the clinician fails to understand or respond to the patient's concern, or if they belittle their reaction, fear is likely as a result. This is especially true when a patient has no ability to control stressful or fearful situations. Clinicians who are empathetic, on the other hand, can respond in a way that inhibits the development of fear. So there's two ways, according to the textbook, that fear can develop is through the negative experience or through the relationship between the clinician. So we're going to talk about how clinicians can recognize fear and anxiety. There are three primary sources: the self-report, the behavior indicator of fear, and the physiological indicator of fear. The self-report is the principal method for obtaining information about a patient. It allows the patient to express both negative and positive aspects regarding past dental experience. Information may be obtained in a one-on-one interview or by using a simple questionnaire that may include some of the following questions. How long has it been since your last dental visit? I always ask this, especially for new patients. If it's been a while, I can kind of feel that, I can kind of see, or just watch their behavior in the dental chair, see if they're kind of every time I pick up an instrument, if they're kind of moving a little or wiggling a little, especially during the cleaning. What kind of treatment did you receive? How did it go? Are there any concerns about receiving injection? Is there anything that you would like to do or not do during today's appointment? What will make receiving an injection easier for you? Have you guys ever been asked these questions at your first initial visit? You remember? You kind of came in very relaxed then. Okay, so the next one is the behavior indicator of fear. It includes overt signs such as pacing the waiting room, fidgeting, wiggling the hand, hands or gripping the arm of the dental chair until the knuckles turn pale, or white knuckles as we call it. And all that happened in that one video I showed you with that patient. Patient may talk increasingly in order to avoid dental treatment. Signs of fear in the operatory also include opposite response, such as quiet or non-responsive patients. So the physiological indicator of fear include perspiration, change in respiration, shallow breathing, and increased heart rate and blood pressure. Patients also frequently hold their breath during injection. Unfortunately, the increased tension caused by holding one's breath actually lowers pain tolerance. Sensitivity generally increase, and procedures are commonly more uncomfortable throughout. The perception of increased patient sensitivity and discomfort sometimes encourage the clinician to administer the anesthetic more quickly, which then can cause discomfort like the burning sensation. Once a fearful patient is identified, we can do the strategy for treating fearful patient. You can do this by building a trusting relationship, which is critical to successful treatment. Dentistry is a social interaction, and research has shown that clinicians' personal attitude and professional behavior impact a patient's attitude towards dentistry. The communication is the most important way to manage dental phobia. This means the way that the dentist and hygienist interact with the patient. The patient needs to feel at ease with their dentist or hygienist in order to overcome their fear, and the dentist and hygienist needs to know what the patient fear and how we may be able to help the patient. Communication also means things like rapport, body language, and using non-threatening language that the patient can understand. Rapport also implies a relationship of equals where the patient don't perceive the dentist or hygienist as threatening or consenting figure, but as a partner in their care. Communication means that the patient do not do things together with their dentist or hygienist rather than the dentist or hygienist doing things to them. Interpersonal rapport, open two-way communication, empathy, and professional confidence are important to establishing trust. Patients should be encouraged to explain their fears and concerns, to express their likes and dislikes, and to answer questions. Fearful patients frequently need help learning to be assertive and to express their needs. Good communication is an important means for fearful patients to begin to exercise control over what is perceived as a potential threatening situation. So that was the first strategy, the patient and clinician relationship. The second strategy is the patient's sense of control over a potential threatening environment, and this includes